blood sugar drops in 30 days with these two teas. No one talks about this. How long have you been dealing with diabetes now? Is it months, years, maybe even decades? And let me ask you this. Are you tired of following every single rule your doctor gave you, only to still see your blood sugar acting unpredictable? You know what I'm talking about, right? You count every carb, you avoid sugar like it's poison, you take your medications exactly on schedule. But here's the frustrating part. Your blood sugar still jumps around like it has a mind of its own. Am I right? Some days it's perfect, other days it spikes and you're left wondering what you did wrong. Sound familiar? You're doing everything right with food. So what's actually going wrong here? The truth is, traditional diabetes management advice misses one huge factor that affects your glucose more than most people realize. While everyone talks about what you eat, almost nobody addresses how stress and tension in your body can send your blood sugar shooting up, even when you haven't eaten anything sweet. This connection between your emotional state and your glucose readings is something that diabetic patients experience daily, but it rarely gets the attention it deserves in standard medical care. What if I told you that 2 simple calming teas sitting in your local grocery store right now have been shown to help with blood sugar control in ways that doctors can't explain through traditional medicine alone? These aren't exotic herbs or expensive supplements. They're common teas that have been used for generations. But recent research from major universities has uncovered something remarkable about how they work for fighting diabetes. We're talking about real, measurable results from people just like you who added these teas to their daily routine and saw improvements in their glucose readings within weeks. This isn't about replacing your medications or ignoring your doctor's advice. It's about adding a natural diabetes remedy that works alongside everything else you're already doing. The best part is these teas don't just help lower blood sugar naturally. They also tackle the stress and sleep problems that make diabetes harder to manage in the first place. Over the next 20 minutes, I'm going to walk you through exactly which 2 teas these are, how they work in your body to support healthy glucose levels, and most importantly, how to use them correctly to get the best results. You'll learn the specific compounds in these teas that researchers have identified as beneficial for diabetic patients, the best times to drink them for maximum impact on blood sugar spikes, and how to combine them with your existing diabetes solution plan. I'll also share real examples from people who've tried this approach and what they experienced in their first month. Before we dive in, please hit that like button if you're ready to learn something new about diabetes management that goes beyond the usual advice. Share this video with anyone you know who's struggling with stubborn blood sugar readings. And don't forget to subscribe because we're building a community of people who believe in taking control of their health through both medical care and natural support methods. Your comments and experiences matter here. We learn from each other, and every story you share could help someone else who's dealing with the same challenges you faced. Here's what most people don't understand about the diabetes and stress connection. When you're worried, anxious, or overwhelmed, your body releases stress hormones called cortisol and adrenaline. These hormones tell your liver to dump stored sugar into your bloodstream, thinking you need energy to handle whatever's stressing you out. This is why your glucose levels can spike even when you haven't eaten anything. Your body is literally creating sugar from nothing because it thinks you're in danger. Now, you might think relaxation is just something nice to do when you have time, but for people managing diabetes, it's actually essential medicine. When your stress response is constantly turned on, your cells become resistant to insulin. That's called reduced insulin sensitivity. This means your body needs more and more insulin to do the same job of moving sugar out of your blood. Research proves that chronic stress can make your diabetes significantly harder to control, regardless of how perfectly you eat or how consistently you take your medications. Multiple university studies have now confirmed something fascinating about certain plant compounds found in specific teas. These compounds don't just help you feel calmer. They actually work at the cellular level to improve how your body processes sugar. What makes tea for diabetics different from regular relaxation methods is the active ingredients that cross into your bloodstream and directly influence your metabolism. The timing of when you drink these teas matters enormously because your body's stress response follows predictable patterns throughout the day. Morning cortisol spikes, afternoon energy crashes, and evening wind-down periods all create windows where the right natural blood sugar support can have maximum impact. This isn't just about feeling better. It's about giving your body the chemical signals it needs to maintain steady glucose levels naturally. These blood sugar remedies work because they address the root cause that traditional diabetes kits often miss completely. When you understand this connection, managing your diabetic lifestyle becomes less about restriction and more about supporting your body's natural ability to maintain balance. Now let's get into the specific teas that can actually help lower your blood sugar levels naturally. Tea number 1, lemon balm tea. The first tea we're talking about is lemon balm tea, and you can find it in practically every grocery store and pharmacy across the country. It's one of those calming herbs that's been hiding in plain sight, sitting right there on the tea aisle while most people walk past it without realizing what they're missing. Lemon balm tea has been used for over 2,000 years to help people relax and sleep better. But recent scientific discoveries have revealed something remarkable about its lemon balm tea benefits for diabetics. This isn't some exotic plant that costs a fortune. It's an affordable herbal tea for diabetes that works through completely natural mechanisms in your body. What makes lemon balm tea special for blood sugar management is that it contains specific compounds called rosmarinic acid and citronellol that directly interact with your nervous system and hormone production. When you drink lemon balm tea, these active compounds go to work immediately on your stress response system. The rosmarinic acid acts like a natural brake on your stress and blood sugar cycle by reducing cortisol production in your adrenal glands. Think of cortisol as your body's alarm system. When it's constantly going off, it keeps dumping sugar into your bloodstream. Lemon balm tea helps turn down that alarm, which means less sugar gets released when you're not actually in danger. This creates a domino effect that improves your insulin sensitivity over time. Your cells start responding better to the insulin your body makes, which is exactly what you want for better glucose control. The sleep connection is crucial here too. Lemon balm tea promotes deeper, more restful sleep, and good sleep is when your body does most of its repair work on insulin receptors. This is why natural sleep aids for diabetics that also support blood sugar are such game changers in holistic diabetes care. Making lemon balm tea couldn't be simpler. Just steep 1 tea bag in 8 ounces of hot water for 5 to 7 minutes. If you're using loose dried leaves, use 1 teaspoon per cup. The best tea for blood sugar control timing is about 30 minutes before your evening meal and again 1 hour before bed. This gives your body time to absorb the compounds and start the relaxation process before your stress levels typically peak in the evening. Start with 1 cup per day for the first week to see how your body responds. Then you can increase to 2 cups if needed. During your first week, you might notice you feel calmer in the evenings and fall asleep easier. Don't expect dramatic blood sugar changes immediately. The real benefits build up over 3 to 4 weeks as your stress and blood sugar patterns begin to shift. This bedtime tea ritual becomes part of your mind-body diabetes treatment approach that works alongside your medications, not instead of them. Beyond blood sugar support, lemon balm tea offers several other health benefits that make it valuable for your overall well-being. Many people notice improved digestion within the first 2 weeks, especially if you drink it after dinner. The same compounds that calm your nervous system also relax the smooth muscles in your digestive tract, reducing bloating and discomfort. Mental clarity is another unexpected benefit. When your stress hormones aren't constantly elevated, your brain fog often lifts and concentration improves. Some people also report that their joint stiffness feels less severe after a month of regular use. This happens because chronic stress contributes to inflammation throughout the body, and when you reduce that stress response, inflammation levels often drop too. These additional benefits make lemon balm tea a valuable part of functional medicine approach to health that addresses multiple issues simultaneously. One 67-year-old woman saw her morning glucose readings drop from averaging 145 to 128 over 6 weeks, while also reporting much better sleep quality. Lemon balm tea is generally very safe for most people, but there are a few important considerations. If you take sedative medications or have very low blood pressure, check with your doctor first, because the relaxing effects could be too strong when combined with certain drugs. Pregnant women should avoid it, and anyone taking thyroid medications should monitor their levels more closely, since herbs that lower blood sugar can sometimes affect thyroid function. This is why holistic diabetes care should always include communication with your healthcare team. Natural doesn't always mean it won't interact with other treatments you're using. Tea number 2, chamomile tea. The second tea that's showing remarkable results for blood sugar management is chamomile tea, and it works through completely different pathways than lemon balm. While you can find chamomile tea in every supermarket, most people only think of it as a bedtime drink without realizing its powerful chamomile tea benefits for glucose control. What makes chamomile for diabetics particularly valuable is that it contains a unique compound called apigenin, which directly affects how your cells respond to insulin. This caffeine-free tea for seniors has become increasingly important in elderly diabetes management because it addresses multiple health concerns simultaneously. Unlike lemon balm, which primarily works on stress hormones, chamomile tea targets inflammation and cellular metabolism, two key factors that become more problematic as we age and deal with age-related blood sugar issues. The magic of chamomile tea lies in its apigenin content, which acts like a gentle key that helps unlock your cell's ability to absorb glucose more efficiently. When you drink chamomile tea, this compound travels through your bloodstream and binds to specific receptors in your muscle and fat cells, making them more responsive to insulin signals. This is particularly important for seniors over 60 because insulin resistance tends to increase with age. Chamomile tea also works as a powerful anti-inflammatory tea, reducing the chronic low-level inflammation that interferes with normal blood sugar regulation. The sleep metabolism connection here is fascinating. The chamomile tea blood sugar benefits are amplified during deep sleep when your body processes glucose most efficiently. Unlike other natural sleep remedies, chamomile doesn't just help you fall asleep faster. It actually improves the quality of sleep phases where metabolic repair happens. Preparing chamomile tea requires slightly different timing than lemon balm to maximize its chamomile tea benefits. Steep 2 tea bags in hot water for 8 to 10 minutes to extract maximum apigenin content. The best evening tea for diabetics schedule is 1 cup with dinner and another cup 2 hours before bed. This digestive tea for diabetics can also be consumed warm 30 minutes after lunch if you experience afternoon glucose spikes. You can safely combine chamomile tea with lemon balm by alternating them, chamomile with meals, and lemon balm before bed. Store dried chamomile in an airtight container away from light, and it will maintain its potency for up to 2 years. Fresh chamomile tea bags should be used within 18 months for optimal chamomile for diabetics benefits. Beyond glucose control, chamomile tea provides comprehensive health support that's particularly valuable for mature adult health solutions. The cardiovascular benefits include improved blood vessel flexibility and reduced blood pressure, which are crucial considerations in elderly diabetes management. As a digestive health tea, chamomile soothes stomach irritation and reduces acid reflux that often worsens with diabetes medications. Many people notice significant anxiety reduction within 2 weeks of regular use, which creates a positive feedback loop for blood sugar control. The natural joint pain relief diabetes connection is especially important because chronic pain can trigger stress responses that elevate glucose. Chamomile tea contains compounds that reduce joint inflammation while simultaneously supporting better glucose metabolism. Building chamomile tea into your daily routine requires a systematic approach for age-related blood sugar issues. Start by replacing 1 caffeinated beverage per day with chamomile tea, preferably in the evening to avoid disrupting established morning routines. Track your fasting glucose readings for 4 weeks to establish baseline patterns. Then monitor changes as you increase consumption. Most seniors over 60 see optimal results with 2 to 3 cups daily, but individual responses vary based on medication interactions and overall health status. Adjust timing based on your personal glucose patterns. If morning readings are your biggest challenge, try adding a cup after dinner. Long-term sustainability comes from finding the chamomile tea schedule that fits naturally into your existing habits rather than requiring major lifestyle overhauls. This tea for inflammation approach works best when it becomes an enjoyable part of your routine rather than another medical chore to remember. The question I get most often is which tea is better for blood sugar management, and the honest answer is that it depends on your individual challenges and daily patterns. When comparing lemon balm versus chamomile, think of lemon balm as your stress-fighting champion and chamomile as your metabolism booster. If your glucose spikes happen mainly when you're anxious, overwhelmed, or having trouble sleeping, lemon balm should be your primary choice because it directly tackles the stress hormone pathway. On the other hand, if your blood sugar issues are more about insulin resistance, inflammation, or digestive problems after meals, chamomile targets those mechanisms more effectively. Some people respond dramatically to one tea while seeing minimal effects from the other. And this isn't unusual. Your genetics, current medications, and overall health status all influence how these compounds work in your system. The dual approach diabetes strategy recognizes that effective management often requires addressing multiple pathways simultaneously, rather than putting all your effort into one solution. Creating the best tea combination schedule requires understanding how these teas complement each other, without creating conflicts or overwhelming your system. The safest approach is to space them at least 4 hours apart, using chamomile with meals for its digestive and anti-inflammatory benefits, and lemon balm in the evening for stress reduction and sleep support. This tea combination guide allows you to maximize tea benefits by targeting different aspects of glucose control throughout your day. Morning chamomile with breakfast helps prepare your metabolism for steady energy. Afternoon chamomile after lunch prevents post-meal spikes, and evening lemon balm creates the relaxation response needed for restorative sleep. The herbal tea synergy happens because you're addressing both the immediate causes of blood sugar fluctuations and the underlying stress patterns that make diabetes harder to manage long-term. Start with this schedule for 4 weeks, then adjust based on your glucose readings and how you feel. Some people need more chamomile for inflammation control, while others benefit from extra lemon balm for anxiety management. You can get started today by visiting any grocery store or pharmacy. Both teas are widely available and affordable. Where to buy quality versions matters less than consistency, so choose a brand you can easily find. This implementation guide emphasizes starting with 1 cup daily of whichever tea addresses your primary concern, then adding the second tea after your body adjusts. Track your progress using your existing glucose monitor. Write down readings with notes about sleep and stress levels. Don't expect overnight changes, but notice how you feel after meals and sleep quality improvements. Most people see improved sleep within 2 weeks, while blood sugar improvements appear after 4 to 6 weeks of consistent use. You're joining a diabetic community that combines medical care with natural health solutions. Discuss these teas with your healthcare provider, especially if you take multiple medications. The holistic wellness approach works best as part of open conversation with your medical team, not as a replacement for prescribed treatments. Subscribe for more evidence-based content bridging traditional medicine and natural approaches. Share your experience in the comment below after trying these teas. Your story helps our diabetic community grow stronger. Next week covers diabetes nutrition tips about foods that spike or stabilize glucose, so enable notifications. Remember that small consistent changes create the biggest improvements in diabetes management.